everyone, I am Keisha Nuevo from DSN 12E and today I will going to perform female urinary catheterization. Urinary catheterization is the insertion of the flexible tube or the catheter through the urethra into the bladder to empty the urine. Catheterization reduces the risk of infection and kidney damage by making sure that the bladder is empty either continuously or at regular intervals. This is also usually used when people are having difficulty urinating, natural relief, or this could also be used before or after a surgery if necessary, and also this used to help in performing a certain test. First, checks the doctor's order for catheterization to ensure that I have the right patient and procedure to be done. Now, prior to conduct the procedure, I have already checked the doctor's order for catheterization. Next is wash hands before preparing the set. This is to prevent the spread of microorganisms that causes disease or contamination. Identify patient and explain the procedure. This is to know if the assigned patient to you is inclined and so that the patient will know what will be conducted to them. So I have already prepared the necessary equipment that I need in conducting the procedure and that are includes the two-way folic catheter, urinary bag, catheterization set. So good morning ma'am, I am Keisha Nuevo, your student nurse for today. And may I see your wristband please? Please state your complete name and birthday please. Okay. So, ma'am, I understand that you are having difficulty urinating, and so that your doctor, which is Dr. Ali Sonfardo, has ordered to you to have a urinary catheter. So, what I'm going to do is insert a tube through your urethra and connect it to your bladder. Then, by the way, later in the procedure, please make yourself relax so that we have the procedure continuously and peacefully and you can feel relief after that. Will be that alright, ma'am? So, do you have any questions or clarifications? Okay. Provide privacy by screening or closing the room and position patient in a dorsal recumbent with the knees flexed. This is to provide the privacy to the patient and keep all the assessment private and also this proper position to provide good visualization of the meatus where we will be introducing the catheter. Also, the gravity will aid the flow of the urine when the bladder is higher than the end of the catheter. So, I'll already close the door and the curtain so that no one from outside will be able to disturb while we are doing the procedure. Now, my patient is already at the dorsal recumbent and his her knees is already flexed. So, next thing to do is that secure the urinary bag on the patient's bed frame. The urinary bag should be below at the waist level of the patient. Drape the patient, exposing only the area to be used. This is to avoid the patient from getting embarrassed and having chills that can cause their tension and which may interfere the easy insertion of the catheter. So, ma'am, I'm going to expose your genital area.
Ano yung
And I'm going to place a pad underneath so that we can protect the bed from linen from getting soiled, okay? So lift your buttocks, ma'am. Okay, I will help you with that. Apply direct light for visualization of genital area. This is to set the genital area clearly. Open the tray and arrange the equipment for convenience and accordingly to avoid contamination of the sterile items. This is to maintain the sterility and the cleanliness of the equipment needed in conducting the procedure. So inside my tray, I have a pickup forceps. And I will use my pickup forceps to arrange it so that the sterility will be remain. So the inside my tray set, I have the eye sheet, the sterile gloves, cotton balls with cleansing solution, refilled water, a 10 cc syringe, which is I'm going to use to inflate the balloon of the urinary catheter. Also I have a lubricating gel, and last is the another pickup forceps. Using the sterile forceps, cleans the area using cotton ball with a betadine. This is to keep the cotton ball sterile and to clean the genital area of the patient. First, in the line down, and first is I will do it in the line, then down, and then I'm going to discard it. So next is the in the labia majora. Remember, we should not rephrase the stroke to ensure that we will not contaminate the king's area. In the stroke of number 7, and then discard. And then in the labia minora, in the stroke of 7, and then discard. Open the set, observing sterile technique. This is to ensure that all the equipments needed are free from any microorganisms and keep them sterile. So as you can see, I already opened the set of catheterization set, and it's already sterilized. So then I'm gonna put on my sterile gloves. This is to prevent the spread of any microorganisms present. And then I already perform hand hygiene, and then I done my after I before I'm done my gloves. So next is put on the eye sheet. This is to keep the other area clean. So Now I'm going to place the eye sheet on my patient. So, lubricate the catheter about 1.5 inches, being careful not to plug the eye of the catheter. This is done to reduce discomfort and friction, which in turn may reduce pain upon insertion, infection, and application of the urethra. So I'm gonna pick up the catheter using my forceps so that it will maintain stereo. And then I'm gonna lubricate it. So now I am going to connect the catheter to my patient, and then with a pre-filled syringe, I already lubricated, and about 1.5 inches. Pick up the catheter at least 3 inches from the tip of the thumb. Place the thumb on the finger on the left or right hand between the labia minora and separate and pull up gently. This is the proper position in easy insertion of the catheter. So I'm going to place my tray here. I'm going to place my tray here, and then pick up the catheter with one place and another on the hand on labia minora of the patient, separating the area surrounding the meatus. So insert the catheter of the meatus for 2 to 3 inches or until urine begins to flow. This process helps visualize urethral meatus and relax internal urinary sphincter for easy insertion of the catheter. So, ma'am, I'm going to insert the catheter, and please relax, okay? Okay. And then, if a specimen is collected, pinch the catheter with the thumb and the finger while placing the specimen container in position. Urine will flow out in the catheter if the lumen is not oculated. Rest the hand in the pubis while holding the catheter in place to prevent pulling and pushing of the catheter. Withdrawing and pushing the catheter back in the urethra may cause infection of the urethra. So, connect the catheter to the urine bag. Urine bag is an equipment used in partner with catheter. It will be the one who will collect the urine from the patient. But first, we need to ensure that the urine bag is closed so that to avoid leakage and maintain the sterility of the connection. Okay. Inflate the balloon 10 to 15 cc of sterile water using 10 to 15 cc syringe. The balloon will prevent the catheter from slipping out of the patient's body, and also when the catheter needs to be removed, then the balloon will be deflated. So, secure and running catheter by tapping the patient's thigh allows some slang and tubing to accommodate the patient's movement. The thigh is the best area to take the catheter in indoor males, and in males it would be in the abdomen. So now I will be moving the eye sheet. So place the patient comfortably so that the patient will feel comfortable after the procedure. So now, ma'am, I'm going to cover you up, but first I'm going to get this kidney basin and take this pad below. Then if your buttocks, I'm gonna help you with that. Do the aftercare and record the time of the procedure done, amount, and the color of the initial output. So, to clean all the equipments used and record the procedure done so that the doctor will know if you are already do the things that needed to be done for the patient. So, doing the recording of the urinary catheterization procedure always include the date, time of the procedure, type and size of the catheter used, and the amount of the fluid used to inflate the balloon, and lastly is the character of the amount of the urine, the reaction and the response of the patient, and other significant observations.